How do we size on the IVIS? I mean, just to put some basics into perspective, this is a lesion. We define our landing zones by plaque burdens of less than 40%, which is at the edge of a critical lesion. And so if you find a critical lesion, you go to the end, scroll, come back, and find an area or a band which has less than 50% or 40% plaque burden. That's a landing zone distally in this case, which defines a luminal diameter of 3, an area of 7.1. You do the same proximally, and you get a larger area because there's a branch. Now, once you've decided that, you know that this is going to determine endpoints. Endpoints means your angioplasty is going to be planned in a way that you meet a certain endpoint before you start, and that's the whole idea. Now, this means that you'll need anything from a 26 to a 30 millimeter stent because that's the distance between the two areas. And that makes a choice of a stent, and that's how you size it. You size it based on the distal reference zone and the area which is proximal to that to a branch. And proximally, when it's large, you go to the proximal reference zone, which is the proximal luminal area, and try to match it up to the carina. Once you know that, the size for this particular stent would be based on the distal main branch, which is going to be 3.0, and you could take a 26, 28, or 30. Once you do that, you know that your expected MSA for this area is going to be 7.1 distal to the carina, 9.5 proximal to the carina. Now, this is your endpoint. This is your expected endpoint. And then what you get is going to be then compared to what you get. And if it is less than 80% of what you expect, then it's under expansion. So under expansion in this, beyond the carina for this would be less than 5.5. Before the carina would be 7.1. The other thing to note is that arteries are never as geometrical as I showed, and there's positive vascular remodeling. So this slide just goes to show that you cannot choose EL in the lesion of the plaque to size your stents. The sizing of the stents should be done based on the landing zone or the normal segment of the artery and then come back. And then a simple rule of maybe you don't have a landing, suppose it's a long artery which is 40 millimeters, you come back and you take 0.3 per 10 millimeters addition. I think with that, we are going to have an exciting session today. So just to put all these definitions into perspective of under expansion, I thought I should just make those 5 case presentations. I'm going to get my colleague, Dr. Vijay Kumar, to present the problem.